Hi, I'm Barbara Wall, licensed massage therapist. Welcome to my studio. Today, I wanted to show you the difference in therapeutic massage versus just the relaxing massages. So, I have with me today my client Matthew. And Matthew, you're willing to be videoed today for demo purposes?
Yes, ma'am.
All right. So, we're going to go ahead and start showing. Matthew has been complaining of neck and shoulder issues, causing a little bit of dysfunction as far as not so much not having the full range of motion, but more of having pain at the full range of motion to completely lift his arms over his head doing certain other movements. So try and loosen some muscles up today, see if that can make things better. So we come in starting just asking you to lay there. It's the hardest job you have. Just let yourself sink into the table. Just close your eyes and try and picture your favorite place that you can just let go. Try and loosen up muscles to the skull. Work from top down. Try and loosen up as we go. Loosen up muscles in the face. Right sinus is a little congested. Any questions you have, you can ask, okay? Yeah, cervical muscles, your neck muscles are super tight. Okay, so we're going to do a little bit of stretching for you. So just let yourself go with it, okay? No need to help or to try and fight. Feels like a good stretch?
Mm-hmm.
Okay. Okay, just let your head drop. That's fine. Alright, and one more. First one was just a pre-stretch to get the muscles ready. This one's actually to get the full extent of the stretch so we can get the muscles fully warmed up. I will always do 2 stretches so we can tell what's the full length of the stretch. Just let your head drop. Okay, off to the side. Doing okay, Matthew?
Mm-hmm.
That's one. And the second one. There's that end stretch. Stretching all of the side muscles, your scalenes. Make sure that we can loosen up the cervical muscles. And bring you back to neutral. And then we turn the head. Bring chin to your chest. Stretch the back cervical. Two. And always do everything equally, so both sides get the same attention, same treatment. Now I feel you've relaxed. Make sure the chin is clearing the chest. Just let your head drop. Now we got muscles warmed up, loosened up. turn this way. And a lot of tension in the muscles in the neck. Everything is very tight, compressed. To work this out, starting with just very lighter touch and trying to work into deeper musculature. And trigger point. So trigger point is just a knot in the muscle. The muscle fibers have tied up on each other and are held together with lactic acid, just a muscle byproduct of general everyday use. Can make it very difficult to get it out. Right there. You doing okay, Matthew?
Mm-hmm.
Getting muscle to move along where it wasn't before. How are you feeling?
Good.
Is that sending anything anywhere?
Not really. It's more shooting upwards than anything.
Yeah. And sometimes trigger points will send pain below or above. So sometimes, depending on the points you hit, especially the neck, we'll either send it into the shoulder, down the arm, or send it up to the temple. That can do that, or in other areas of the head. It's right there.
Mm-hmm.
Okay, so just some nice, slow, deep breaths in through the nose and out through the mouth. Try and help things slow down a little bit. Get things to open up. Now, on a pain scale of 0 to 10, where are you at?
As far as the neck goes, it's more like a 4 or 5.
Okay. Ideally, nothing should be above 7, 7.5 on a pain scale. So that way, clients, it's a good hurt, if that can make any sense. It's supposed to be the hurt so good in that process of there's going to be pain, but it still feels good, is the minute the muscle will start to release. Above there is where clients will feel bad pain, and all that is being done is compounding the issue that they're looking to have worked on. Not necessarily that anything's going to be fixed, especially not in one treatment. All I'm doing is helping to give the body the opportunity to heal itself, just through education and through my skills. time to check left side, right side. Okay. So a little tighter on this side. Extra trigger points. And that one's closer to the base of the skull. Right there. You doing okay?
Mm-hmm.
Doing little circles. Try and work it free. Please let me know if any of these reaches above 7.
Will do.
That whole muscle right there. Super tight. The right side muscles feel almost like cord, that they don't want to move that much. You doing all right?
Mm-hmm.
Okay. If you need to, just breathe in through your nose, out through your mouth. I know this can be a little intense.
I had about a 6.
Okay. Yeah, but now the muscle's moving again. Now, after this, you're going to want to make sure you do an ice pack for 20 minutes, okay? Make sure that you're drinking plenty of water. Those muscles are freed up. Okay, arms down along your sides. Okay, now moving into shoulder dysfunction. All right, so if you would please grab your right shoulder and just let your arm fall. So we're going to check one of the rotator cuff muscles. And I know this isn't comfortable, but it shouldn't be completely painful either. Right there. Doing okay? Okay. Where are you at on a pain scale?
5 to
Okay.
5 and 5.5.
All right. Just breathe through. There we go. Just want to try and give the muscle time to release and let my fingers drop in. And try and work through the tension in that muscle and see if there's any trigger points. This muscle is subscapularis, and it's on the underside of the shoulder blade. Helps in a lot of your movement in helping the shoulder blade to get out of the way so your shoulder can achieve all the motions that it's supposed to have. Doing all right? Right there. Okay. So it's still manageable. Good. Yeah, that's never a nice one. I've had clients, but in working that muscle, it's helped them to achieve better mobility to do everyday tasks. Feeling around the joint itself. Okay. Thank you for coming to join me today, and I hope you have a blessed day.